Good morning, I'm Jessica Lovell, and today we bring you an encore presentation of one of our very favorite episodes. Our team is working behind the scenes right now to bring you more amazing stories when our live programming returns in February. If there is an urgent update from the health system, of course, we'll be right here and let you know first. Until then, please enjoy this encore presentation and make it a great day. Life-saving care regardless of the rivalry. Today we hear how the president of Kansas State University stayed strong and stayed working during cancer treatment. Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. College rivalries can be fun to a point, but when it comes to something deadly serious like cancer, compassion and friendship always shine through. Case in point, K-State President Dr. Richard Linton, who reached out to a Jayhawk when he knew something wasn't right.
I knew that this was not normal for my body.
That was the first thought of K-State President Dr. Richard H. Linton when he found a swollen lymph node while shaving.
It was maybe the size of an almond.
Still, he waited several weeks to see his primary care physician who prescribed an anti-inflammatory, but that didn't help.
It went from the size of an almond to maybe a half of a size of a lemon.
So he asked a friend for advice. That friend just happened to be a colleague and ENT specialist and the KU chancellor, Dr. Doug Girod.
He had looked at it and I think he knew that there was something wrong.
Dr. Girod referred Dr. Linton to the University of Kansas Health System.
He came back after the CAT scan. I looked at him and I said, I know what you're going to tell me. I said, you're going to tell me I have cancer. And he says, yeah, I am.
He was diagnosed with stage 2 base of tongue cancer caused by HPV.
The fact that it was HPV positive because of the virus was a really good thing. So the prognosis for me was somewhere between 85 and 90% potential cure rate, which is very, very high in cancer.
Chemo and radiation treatment began right away at the University of Kansas Cancer Center. 6 weeks later, the chemo treatment ended, and on week 7...
Friday the 13th was my last radiation treatment, and at 7:23 is when I got to ring that second bell. Emotional. The end of a marathon, and got to do it with my wife and with my sisters. I rang a bell twice, once for chemotherapy and once for radiation. It was, the end of a very difficult journey. Incredibly proud, and just wanting that to be a moment of, we did it, and let's move forward.
His wife, Sally, their children, Lily and Chris, and 3 sisters weren't the only family that supported him on this journey. The K-State family flooded him with thousands of cards, well wishes, and texts.
When I talk about the K-State family, I define it a whole lot different than what I did before cancer.
And this Wildcat says he'll be forever grateful to his Jayhawk friend, whose guidance ultimately led him to life-saving treatment.
And we are so happy to have Dr. Richard Linton here with us, the president of K-State, front and center this morning with us today. So glad to see you.
Good morning. Good to be here.
Good morning. Great to have you. We also have Dr. Doug Girod, chancellor of the University of Kansas, also longtime head and neck surgeon here at the health system. Good to be sitting next to your friend, I'm sure.
Well, thanks for having me back. Great to be here.
Yes, we're looking forward to talking more about this. Across from me are 2 of Dr. Linton's doctors at the University of Kansas Cancer Center. Both of them are head and neck cancer specialists. We have medical oncologist, Dr. Parkash Nupani. Hi, good to see you today.
Thank you.
Thank you for being with us. And radiation oncologist, Dr. Gregory Gahn. Good to see you, Dr. Gahn.
Great seeing you guys again.
Yes. Okay, full table and lots to talk about today. So, Dr. Linton, go back to those first warning signs. So, you noticed this lump. Any other symptoms or signs that alerted you to anything?
Back in the middle of June last year, I noticed while shaving just on the side of my neck that there was a small, maybe almond-sized lump. And this lump continued to get bigger. It got about the size of my index finger. And it just would never go away, and it was a hard lump, and the more I read, the more I became concerned that it might be something more than just an infection.
Interesting. Well, you were shaving, huh?
Yes.
Like you're just down here on your lump, where was it?
So it's right here. There's still remnants of it that's still here today, but it was far larger back in the middle of June last year.
But an interesting checkpoint, because men are shaving every single day. Something, a good way to be feeling areas that you should be checking out. So Dr. Girod, how did you approach Dr. Girod and said, hey, this just doesn't seem right?
Well, I knew something was wrong, and I'm new to Manhattan, Kansas, and really didn't have a network of physicians, and so really the only physician I really knew well was Dr. Gerard.
Not a bad one to know.
And he's also an ENT, and just had a couple of conversations with him while I was on vacation in June and July, and then when we met at a retreat back at the end of July last year, he kind of felt the side of my neck and then took the corrective action that we needed.
Yeah, it's nice to know who you can call. So Dr. Gerard, lots of things we know cause swollen lymph nodes. That can be pretty benign sometimes, but based on what Dr. Linton was telling you, what were your concerns initially that made you say, we got to get you in?
Well, as a head and neck cancer surgeon, we see a lot of lumps in the necks, and while they can be benign, in adults, it's very commonly benign in young people, but in adults, for us in particular, we think cancer until proven otherwise.
Really? Okay. Yeah. That's because, we say, when people feel, you're right, that's interesting to see about young people, but the older you get, the lumps really matter.
Yes.
Don't ignore those signs. This was Dr. Linton's stage 2 base of tongue cancer, is that right?
That's correct.
How did you process hearing that news?
I think you go through all the different stages. I think in the beginning it's almost disbelief, but then it becomes, let me find out as much information as I possibly can, and let's attack it and let's go after it, just like I've tried to do in everything in life. And I had a great support system both here at KU and at home to be able to help me work through it.
How'd your family handle the news and tackle it alongside you?
They were just like, let's go after it. My wife and 2 kids were incredibly supportive, and then I had 3 sisters that traveled from around the country to be able to be with me. I was not apart from somebody for a single day during my 7-week treatment. Someone was with me in my hotel room and for every single treatment I had, which was incredibly reassuring.
You don't realize that until, just if you're having a down moment, as you start to fall down, someone's there to push you back up, right?
That's right, yeah.
So Dr. Nubhani, Dr. Ghan, help us understand the staging and the diagnosis. Why the distinction of base of tongue cancer?
Yeah, base of tongue cancer is quite often, particularly non-smoker, is caused by human papillomavirus, the HPV. And the staging, with the newer staging, it's updated staging within last year or two, where tumor, we look at the tumor size. In this case, Dr. Linton had more than 4 centimeter size of tumor in base of tongue, and straight to the lymph nodes, and only one side of the neck. So that makes it stage 3 and the staging system. Current staging system.
Dr. Linton mentioned in the piece we saw that the HPV factor was actually a good sign. Why is that?
Yeah, no, the HPV is actually, so it's, it's a virus and everything like that, and it actually, is associated with this type of cancer. So oftentimes, we think of head and neck cancers being driven by smoking and by alcohol use, but this one, being driven by a virus and everything like that, it's actually quite different, and it actually is centered mostly towards the oropharynx. And with that, we're seeing this rise, in oropharynx, in this HPV-mediated oropharynx cancer. And so people have done analyses to actually kind of look at this and say, like, so how do, older traditional kind of smoker-mediated oropharynx cancer patients do in comparison to HPV, virally mediated oropharynx cancers? And those who have this do far, far better. And so they respond to our treatments better, and they also do better. So it's great.
Maybe just number-wise, kind of put it into perspective, just how common this type of cancer is, and then maybe how rare it could become now that we have the HPV vaccine.
Yeah. So I think in the United States, they predict roughly about 8,500 to maybe 9,000 cases a year of oropharynx cancer. But of that, it's like 80% of them, it used to be that it was like, well, we don't know what it was probably 30, 40 years ago, but nowadays it's about 80% of most oropharynx cancers are HPV mediated, just because we see this reduction in smoking in the United States, fortunately.
So let's talk treatment. Instead of one treatment followed by another, Dr. Linton received chemo and radiation simultaneously. Why is that?
So the purpose of chemotherapy is two ways, and one is to kill the cells, the microscopic metastasis, if something floating around. The second, and the most important factor in this case, is to help radiation work better. Chemotherapy sensitizes tumor cells for the radiation damage, and when we do radiation together, we have a better local response to the tumor.
So, Dr. Linton, what were discussions like with your doctors and your teams? I'm sure you had lots of questions. Your family probably had lots of questions.
Great. I don't think that there was ever a question that I couldn't feel comfortable in asking to be able to get a really good answer. What I would do every single day before I came to the doctors is I would have a notebook. This was a great recommendation that Dr. Gerard gave me early on. He says, keep a notebook. Write all your questions in the middle of the night to be able to make sure that you have them answered. And I typically ask the same questions to both doctors, and the answers were almost always the same response. But I also had a support system in my family. I've got a brother-in-law that's a radiation oncologist and a sister that's a radiation physicist, and so collectively with this team, they were incredibly helpful in helping me understand what was going on and kind of what was forecasted for the future in my treatments.
Dr. Gahn, you provided some scans. Can you walk us through that and what we're seeing?
Yeah, no, happy to. So these are Dr. Linton's what we call pre-treatment scans. So on the left, you have a CT, a computer tomography or CT contrasted scan of the head and neck, and then on the right, you have the PET-CT scan. So kind of what's been delineated there with kind of like that kind of cross there and everything, that's the size of his lymph node, and then after that, you can just see just to the right of that lymph node, there's this kind of abnormality that's kind of sitting where normally the normal opening of his throat should be, and that's where his base of tongue cancer is. Now on the right, you see the PET-CT scan. This is a radioactive sugar, which we give to help with diagnosing certain conditions, and it's particularly useful for cancer. You can see that that kind of pinkish red that's lighting up is actually the lymph node as well as his base of tongue cancer. And so it kind of helps us to kind of zero in on what we need to look for.
We seeing something different here?
Yes. So this is Dr. Linton's photon radiation treatment plan. So this is kind of, as you can see and everything, there's a whole bunch of rings and circles and everything like that. So this is kind of commonly how radiation oncologists look at their plans. And so we work with a dosimetrist, we work with our physicists, and then with myself, who help to delineate and define what our target is. So you can see within those rings, they kind of help to cover both the primary tumor, the lymph node, as well as kind of the neck on both sides. And so on the left, you see kind of images of him kind of taken what we call axial scans, and then after that, the one on the right, coronal scan. So kind of you can see kind of that that three-dimensional look of kind of what this radiation treatment plan looked like.
And I believe this is, what, 3 months after chemo?
And this is 3 months after chemotherapy and radiation. So Dr. Linton had the opportunity to come back and kind of talk to both Dr. Nupani and I. And you can see on the left before, on the right after, and from that you can see that the original areas that were super bright, super kind of lit up, are actually now cold on the right scan. Some of the other things that you see, kind of that smaller stuff, you can see that they're on the same side. So in case somebody's wondering, like, hey, wait, no, we don't see any, there's still pink there. A lot of that is also normal muscle tissue, which can also light up in immune cells. But the bottom line is, when you actually look at the before and after, this is something that we were quite pleased with.
Those are before and afters we really enjoy seeing here on the program. Dr. Linton, how did you handle relocating to Kansas City? You had to do this for, what, 7 weeks?
Yep, so being in Manhattan, Kansas City is about 2 hours away from me. So really the only way to do it and to lessen my stress level was to Sunday night head on out to Kansas City, and I stayed at a hotel in the plaza for 7 weeks and then would come home every Friday afternoon so that I could be home with my family on the weekends. And still during that time period, even during the most difficult times, I was still working somewhere around 55 to 60 hours a week, a lot of Zoom calls for me.
So you were in the hotel down the plaza, working it, doing your thing.
My treatments were done at 7:23 every morning. I was in the office before my colleagues were.
You're like, no excuse. You're like, I just did my treatment and I'm here doing my thing. And I take it that was good doctor's orders to just do life as normal as possible?
I think they would have liked me to do a little bit less, but I found for me, that working made me not think about things and
Yeah.
made me focus on the really positive things going on in my life professionally.
Yeah.
And that was my way of kind of, creating some kind of salvation for myself.
Yeah, nothing like working 55 hours a week and heading up a big university to bring your stress levels down, right?
But this is
It's a good distraction.
This is an easy week for presidents and kids.
That's what I was going to say. 55 hours, get out of town. Side effects for the treatment, what was that like?
Yeah, so during the treatment, the two biggest challenging side effects, I lost all voice for about 2 weeks, which is a little scary, and couldn't eat anything for about 6 weeks, so I had a PEG feeding tube during the treatment and then far afterwards. And I think dry mouth is another side effect as well. Fortunately, today I've got 100% of my energy back, 100% of my voice is back, and I have about 95% of my taste. I had lost 100% of taste.
Ugh.
So eating a bowl of Raisin Bran was like eating a bowl of wood chips. And I can tell you today I'm at 95%, and I feel really, really great. The only side effect I'm dealing with now is a little bit of dry mouth, which I hope the next 6 months it'll continue to improve.
So you make it through, and let's talk
Yes.
about the good stuff. That sound we like to hear, the bell ringing.
Yeah.
You did this at the end of treatment twice. Then later back in Manhattan, you had a special bell ringing with just your family.
Yeah.
Where was that bell located?
Yeah, so I got to ring 3 bells, the chemo bell here, the radiation bell here, and then we have a special bell that graduates of our College of Education ring right across the street from the president's residence, and it's a special bell that you need very special permission to be able to have the rope hooked up so that you can ring it.
Right.
And the dean was kind enough to be able to hook it up for me, and just me and my family went over and rang the bell. It was
Pretty emotional.
pretty special.
Let's
Yeah.
talk about your family. I think
Yeah.
you have some photos. I think they.
Sure. So that's Sally to the left there. She's my wife, obviously, and then my daughter all the way on the left here is going to be a senior now at UNC Chapel Hill, and my son, shown here on the right, he'll be a freshman next year at Kansas State University.
Nice. I have never done that before. You were trying to get us all to do it this morning.
Yeah, everyone should do, but it's
You would.
right hand.
Gerard
right
was
hand-
like, don't
right
push it.
hand-
He gets, he's on a lot. His
Don't do
fingers
that.
don't even do that.
He has arthritis.
but it's that's a WC for Wildcat.
I will do that for you for this one special occasion. But
Thank you.
you're off the hook.
thank
You're off
you.
the hook.
Thanks for covering for me.
Yeah, I wouldn't send you back to Lawrence after doing that here. Okay, so let's talk about this K-State family.
Yeah.
They were there for you. How
They
did that
were.
redefine the whole meaning of kind of your work family?
Yeah, so thousands of people reached out by text, by emails, by cards. In fact, every weekend when I'd come home, Sunday night before I head on back to the hotel, I'd take a bag of letters, and I'd read them over the weekend. Then I'd read them during the week just to give me encouragement. But they were just unbelievably amazing through the entire treatment, and they have been beyond as well. I'm very, very fortunate to be at Kansas State University and have that kind of a close connection with the K-State family.
And then let's talk about this surprise gift at a recent Kansas Board of Regents meeting. What were you giving Dr. Gerard here?
So this was our third time as a charm, kind of a gift. We were hoping to give it to him at the KU basketball game.
Was this a surprise for you?
It was a surprise for me, yes.
Or to do it
yes.
at the Kansas State basketball game, but we did this at a Board of Regents meeting. So I don't know if you know, but the head of the Board of Regents, John Rolfe, also had a cancer diagnostics where Dr. Gerard was incredibly helpful at helping him as well. And so John Rolfe and I wanted to do something special to show our appreciation and our friendship to Dr. Gerard. And we just thought this was the right way to do it. So we took a couple of jerseys, a KU jersey and a Kansas State jersey, and we stitched them up together to be able to show that, like you said at the beginning of the show, being a colleague and being a friend is a whole lot more important and much more real than any competition that we might have on the basketball court or on the football field.
Where are you hanging that jersey? Where are you going to hang
It's in my office at home right now.
Is it? I like
Yes.
that. You've had a lot of accomplishments, Dr. Gerard, but what's it feel like to know that you're truly helping, saving lives and just connecting friends and just being who you are?
Well, when I stepped into this role 7 years ago now, I had to give up my full-time practice and of being a head and neck cancer surgeon and working so closely with this team on a regular basis. But I still have the opportunity to play traffic cop, is how I like to think about it. The people reach out, whether it's President Linton or John Rolfe with the Regents, as you mentioned, and many others, not necessarily with cancer, with all sorts of things. But thankfully I know some people, so
you know a guy.
I can usually get them connected to with where they need to go to get their issues addressed.
Well,
So I'm happy to do that anytime.
Sure. Well, in that high that kind of comes with the territory, being in that high profile situation. But I know you're happy to do it. Let's get to some questions and comments from our viewers. First one is from Ruth Ellen. Thankful to radiologists and doctors who know what they are looking for on those scans and images. So it's good to know. Also, are there any regular screenings for this kind of cancer, and who should be getting them?
Screening, unfortunately, we don't have a regular screening to detect precancerous lesions. Unlike cervical cancer, the screening helps, but this type of cancer, we don't have those precancerous screening. But early symptom is the key thing to diagnose early outside of the precancerous lesion screen.
So Dr. Linton did the right thing. He felt something didn't seem right, wasn't there before, and started asking questions. Another question, has Dr. Linton changed any health-related habits? Anything new you're doing?
I'm eating a whole lot better, and I'm exercising, and that's because my wife is encouraging me
I
to
bet
do
she's
so.
all over it.
She is. My weight is less than what it was, and so I think it does push you into a much healthier lifestyle. And frankly, people have said this to me as I was having treatment. You'll enjoy life more every day, and you do enjoy life more every day, and you have more of a purpose in what you do each and every day.
Did you feel like you were just kind of going along, and then all of a sudden something like this happens and it totally changes your perspective? How did it change for you?
It completely changes your perspective. Things that used to matter a lot don't matter near as much as they used to. And you're just incredibly thoughtful about the work that you do, but you're also very thoughtful about the time that you can spend with your family.
Last question, just in case we missed it, but just what are some typical first symptoms of back of tongue cancer?
Yeah, no, so some of the symptoms that you'd experience, and then I think you'd mentioned some of them as well, Dr. Linton, is that you can kind of get this mass and everything like that develops. That tends to be the most common way that men and women kind of present with oropharynx cancer. But you can also have like sore throat. You can notice change in voice and anything like that. A little bit of discomfort with swallowing. So those things can all kind of impact and everything. And sometimes you kind of get some referred pain too into other areas of the body. So particularly into the ear. So things to kind of just listen to your body and to also kind of seek medical attention or just an opinion or anything like that. Especially when you have someone like Dr. Gerard who you work next to.
Right, that helps. Okay, so as we wrap up today, I just want to get everyone's takeaways. Dr. Gahn, let's start with you. What do you want folks to walk away with today?
Yeah, no, I think just as mentioned, I think for oropharynx cancer, particularly HPV-mediated oropharynx cancer, this is curable and potentially, I think, more importantly, preventable. So I think vaccination should play a very important role and should be discussed and everything like that. With kids, adults, and everything like that, and trying to prevent this type of disease. And I think, thankfully, we have some good vaccines available. So this is something that I think can dramatically change public health and improve quality of life as well as prevent cancer. That's one. And for those people who have questions about cancer, it never hurts and everything to get a second opinion here at KU and everything. We're always very happy to kind of provide our thoughts and everything like that objectively.
Dr. Dumpani, what's the takeaway?
I think the symptoms, presenting symptoms are so common and very non-specific actually. Talking about sore throat, discomfort. So every sore throat, we don't need to panic for that. But if the sore throat does not go away in reasonable time, few days, a week, then that should be a concern. So we shouldn't panic every day, live your life, but if something stays there persistently, seek medical advice.
Yeah, know your body. All right, Dr. Gerard, what's the big takeaway?
Yeah, no question for me. It's the preventable nature of this, and our vaccination rates in the country are not very high. And we know that HPV is #1 cause of cervical cancer in women. We've known that actually for a long time, but it's really just been in the last 15, 20 years or so that we've realized the HPV nature of oropharyngeal cancers, again, completely preventable with appropriate vaccination. So children can certainly be vaccinated, but young adults can as well, and just can't encourage enough folks to get their kids vaccinated, so we aren't dealing with this disease 20 years from now.
Do you mind if I give the Wildcat the last word?
Go for it.
All right, Dr. Linton, what is the big takeaway from your story?
So for me, I think it's listen to your body. When something's not right, listen to it. Don't feel like you can't reach out to people to be able to ask for help and ask for additional information. And then it doesn't matter how bad the outcome is, you can make it through even a pretty difficult treatment that I had. And I would say as well with the HPV vaccine, I can't tell you how many people have reached out to encourage them or their children to be able to get this vaccine. This is completely preventable. If you have that vaccine, we have it now. I wish we had it 20 or 25 years ago, but that's the most important thing for prevention.
Well, and just to be clear, this is why we have you share your story, because someone's going to hear it and then someone's going to do it.
Get that vaccine.
Gentlemen, thank you so much for being with us today. It's been a real pleasure.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now, everywhere podcasts are available.